Today, multidisciplinary care and psychosocial support for patients with myeloproliferative neoplasms, or MPNs. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. Care teams work hard to alleviate symptoms and control disease progression during the treatment plan for patients with MPNs. But often, the psychosocial burden of MPNs can weigh on patients and impact outcomes. Here to discuss how providers can better support patients is Sarah Everette, a licensed clinical social worker and oncology social worker at Baptist Health Louisville.
Some specific challenges are, I like to kind of break them into three areas. Practical concerns such as transportation barriers, financial distress, and sometimes people have lack of insurance or they're underinsured and they need assistance with making sure they have good health insurance. And then home care needs, and then I break it into emotional needs too.
How do symptoms of depression, anxiety, and stress show up in patients?
It can show up with insomnia, people that are struggling to sleep. It can show up when they're having feelings of hopelessness or helplessness. A lot of times our patients will be screened for depression and anxiety when they come in for a visit with their oncologist. And if that score is high, if that's elevated, then our social work team will get a referral to assess further to see how the patient is feeling from an emotional standpoint and assessing their mood, focus, concentration, things like that.
How can the care team offer more support to patients?
Making sure that your staff knows about transportation options within the community that you are serving, working with foundations or grants to try to provide transportation. You know, we're fortunate here in Louisville, Kentucky to have a partnership with Lyft where we can, if the patient is ambulatory and can safely get in and out of a car, then we can easily get a patient here to treatment if they do not have a vehicle of their own or they do not drive any longer or have anyone that can bring them to treatment. So finding out what's available, you know, within the public transient system and then what you can do to help patients get in for care.
Is the needs assessment an important tool for the care team?
Yes. And here, most cancer centers are required to administer a distress screening tool. And on that distress screening tool, there are check boxes where you can mark areas of concern, and transportation is one of them, or lack of caregiver support. And when those areas are marked, then our psychosocial team will be notified and we reach out to the patient to assess their needs and then look for appropriate interventions to help them get what they need.
Why is it important to work with a navigation team?
Because sometimes they pick up on clinical aspects that a social worker might initially miss and provide that education about what to expect if surgery is warranted or, you know, phlebotomy is needed or what chemotherapy might look like. So it's what to expect at the beginning because there's so much fear and uncertainty when you're first diagnosed with any type of cancer. And so kind of easing that fear and uncertainty and letting the patient know that you will be supported and helped throughout the continuum of care from the beginning, you know, through survivorship.
How have you seen multidisciplinary care coordination impact patients?
I've had feedback from patients who, if we get them into physical therapy and occupational therapy early in their treatment, it helps with outcomes. It helps them not decondition so easily, especially our elderly, you know, population. But not only addressing their physical symptoms, but also their mental, emotional health too, because we know that you're not just caring for one aspect of the person, but it's the whole person.
Thank you, Sarah. You can check out the show notes for more information on the psychosocial aspects of MPNs. You can also go back and watch the video podcast series on MPNs we posted earlier this year. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Community Cancer Centers.